Welcome back to Haidarviews. Today, I'm joined by Dr. Dhia Mahmud, a highly respected dentist and the owner of Broadway Smiles, a well-known dental clinic in Vancouver, Canada. His journey in dentistry began at Semmelweis University in Budapest, Hungary, one of Europe's top medical institutions, where he built the foundation of his career. In this episode, we'll dive into the story and experiences that led him to pursue dentistry, the challenges he faced along the way, and the lessons he's learned throughout his career. Whether you're a future dentist, eager to learn from an experienced professional, or someone simply looking to take better care of their smile, Dr. Mahmoud's insights will provide valuable knowledge and inspiration. Dr. Dhia, it's a pleasure to have you on. Let's dive in.
Thank you.
Thank you for coming on. Before we begin, can you tell us a little bit about where we are right now?
So we're currently in Broadway Smiles. It's a dental clinic here in Vancouver, Kitsilano area. So welcome. It's very nice to have you.
Thank you. And are you the owner of this dental clinic?
Yes, for third year owning this practice.
Nice.
Yeah.
That's amazing. Well, let's go back to the beginning. You know, every journey has a beginning, and I would like to know, what's your earliest memory that hinted you might end up in healthcare?
So I remember back in when I was around 11, 12 years old, we moved back to Baghdad, which is my hometown. And my father, he's a general dentist. And I used to go with him sometimes to the clinic and walking around with him in the community, the neighborhood around where my dad's clinic. Was in his hometown as well, so he grew up in that area, and he was well known in his area, his status. People call him doctor, all of those kind of things. I would go to the clinic, and it's a clinic in a very humble town. People are very like God's people, very very simple people, loving people. So there was a lot of gratitude when he would do any dental treatment. And that area, like dentistry, was not necessarily very. It was everyone can reach the dental services in that area. So when I see my father relieving people from pain, helping them out, and you get to see this gratitude in them when they thank you, do a little bit of prayer for you, hope everything goes well. It kind of felt good. So I was like, I saw some little like fruits that you could get from that. So I was like, that kind of shifted my focus towards it.
And did your dad want you to become a dentist growing up?
Like he never really kind of like said it to me. I think more like he just kind of I showed kind of the way of it. He never really told me to do one way or the other, but of course, like the life that we lived, all the good things came from my dad being able to kind of provide for us, secure stuff for us. So I kind of saw like the advantages of it, and so but then when he saw that I was interested, he kind of showed his full support.
Okay. And how did he react when you first said, you know what, I want to become a dentist, I want to go to school for it?
Well, I think he was really happy. He didn't, I think, was overjoyous when I told him just to not maybe put more pressure on me, because it's a rocky road to get to there. But it was nice. It felt good. You know, I'm his youngest, so it wasn't like it was something that it wasn't really something important for him. So that kind of didn't put any pressure on me. So I think that helped as well.
Right. And you mentioned that you're the youngest. Are your other siblings also in dentistry?
No, they're not in the medical field. Yeah.
Oh, at all?
No.
Okay.
Yeah.
So that's a little special that it's yours.
Yeah, I think it's nice. Ever since I got into dentistry, it also brought my dad and I closer together. We had a lot more things to talk about, and because we're like, there's a big age difference as well between us, my dad and I. So, but it was nice. We get to talk about it more, and it's because he lived the same profession. He could kind of understand similar challenges, so can understand like where my like thinking process is and all of that. So yeah,
Nice.
I'm very happy. I'm very glad that I've had his support throughout.
And you went to Semmelweis University in Hungary.
Yeah.
Would you say that is a non-traditional route to go into medicine, especially since you grew up in Vancouver, Canada?
Yeah, so being in Canada and seeing how like difficult, or there's a lot of ways where you lots of obstacles to become into the dental field. It was another route, and then just so I had people that have done that route similar, and it goes and like they took that route. So it was a good second option, which I thought was a more plausible option. So I kind of went in full on for that.
Okay, and going through that route, because I know a lot of dental students here in Vancouver, their dream is to go into UBC. I know a couple myself, and they take an exam.
DCAT?
It might be the
Yeah.
DCAT, yes. Did you have to also do that exam to go to Hungary?
No, so to go to Hungary, you just apply. You need like a high school diploma, and you apply there. You don't need an undergrad to go into dentistry. It's a program that goes straight from high school, and I applied through there. You do like their own in-house exam, entrance exam. But I did start my. Here I did like to do a bachelor's of science in health sciences. So I was doing my first year, which kind of took care of the main two topics such as biology and chemistry. So that kind of also helped me and primed me for that entrance exam. But it is when you go there, it's getting into the university is a little bit easier, meaning that you have a better chance to kind of go in. Yeah.
And Hungary is very far from Vancouver.
Yeah.
So when you brought that idea up to your parents,
yes.
We'll talk about patients later. Did you have any resistance to that idea?
So I moved a lot with my family growing up. I was born in the Middle East, and then we moved to Canada, and then we moved back to the Middle East. So there was a lot of movement that's going on. So I feel that going somewhere new isn't something scary as much as like if I've lived my whole place in one area. And because I was going, I had a goal. It was pretty focused goal. I kind of didn't really live the moment of somewhere new, or I just had more of a narrow vision towards what I wanted to do.
Right.
And I wanted the certificate. So which country I go to didn't really matter. It was more about where can I get it done.
Right.
And I was lucky because Hungary is a beautiful city. It's nice in the middle of Europe. I was able to meet amazing people there, and then was able to kind of travel around as well. So I liked that decision.
Nice. And I have a similar story. I went to undergrad here, and then I decided, what, let me just go and pursue medicine right away, not having to do another, a bachelor's degree here in Canada. So I wanted to ask you, how was your experience leaving? I guess you mentioned it was a little easy, but for me it was actually quite difficult because I grew up here, and then all of a sudden I had to go all the way to Aruba, a place I've never been to. I was quite young at that time. Making friends was challenging in the beginning, and getting used to the new society, the environment. Did you also have to go through these kind of troubles?
I was a little bit. It was difficult, of course, in the beginning, challenging because you have to kind of start all over with your peers and stuff. But because we were in a school, the class, everyone was a foreigner. It helped a lot because everyone is in the mode of making friends or making ties, and I joined from like the beginning. It was like first year, so everyone is new, so everyone kind of wanted to make circles, make friends, so that made things a little bit easier, and it was pretty multicultural. We had people that were from all around the world, so it's nice how you could, like, when you meet someone, you see, if you're in the mode to make friends, to get closer, then you tend to celebrate all the similarities rather than pick out how am I different from you.
Yeah.
And going with that perspective allows, like, people see you more kind of approachable, more open, so then you tend to let your guard down, find people easier. So yeah, I've made really great friendships throughout in that in Budapest, which was great.
Okay, that's nice to hear that you had quite of a smooth transition going from Vancouver to Budapest. So now you made it to Budapest and you're starting dental school. How was that experience? Like, is dental school, did you have any challenges, and how did you overcome these challenges?
The the biggest challenge I think was like saying no to going out and having fun and just to stay home and study. Like it was a pretty demanding curriculum, and it was more like year-round studying rather than it's exam times, time to cram it.
Right,
And for it to be like, for you to be able to digest all that material, you have to take it as you learn it, you go the same day and then study it. So staying on top of it with the midterms, staying on top of it with the with like throughout the whole semester. The hardest thing was because again Budapest is such a lively city, lots of things going on. There's also tourists always in town. There's a lot of big events, so that saying no and choosing to stay in on the weekend, choosing to study over doing the fun thing, that was I think the challenging thing. The studies, because it took like once I found out what is the best way that for me to study, it became a little bit like you just need to put the time,
Right.
and just like be smart with your body, like kind of just because it's mostly memory, it's a lot of like time management, so sleeping well. Like after you learn that, which you pick it up probably by like the second, third year, the studies isn't the most challenging part. Is like putting yourself down and actually studying.
I had a very similar experience, and I can completely relate to that because I studied medicine in Aruba.
Yes.
We had like I think it was the third best, most beautiful beach in the world was 3 minutes away from my house.
Oh, yes.
So it was very hard not to just stop studying and go out to the beach. And we had a lot of food trucks there.
Yes.
Get food. I love food. So I can completely relate to that. How many years did you stay in Budapest?
5 years. It's a 5-year program.
Okay.
Yeah.
And what do people usually do once they complete these 5 years? Do they stay in Budapest?
So we had our groups, so most of the, we had the people that are coming from Europe. They just kind of, because they're part of the European, they just go back and they could practice right away. Some of it, for us, the Canadians or Americans, how to come back and do like an equivalency program. So that took me around like 2 years to do these big exams and just basically study the whole dentistry all again. And it was 3 different board exams. One was multiple choice, one was like case studies, and the third one was actually practical on like dummy heads on plastic teeth.
What are these exams called?
That's part of the National Dental Examination Board, so dental like NDEB.
For Canada specifically?
It's for Canada. It's for foreign trained dentists.
Okay.
Yeah.
Okay. So you did have to do an equivalency
Yeah.
exam. Okay. And you can also practice in Budapest?
I could practice in Budapest. Yes.
Okay. And you said that whole process coming back to Canada took around 2 years?
2 years. Yeah.
Okay. I'm sure that was very difficult.
That was difficult. It was difficult moving back home after being on your own. It's difficult. Kind of. It was all self-paced. There was like we had some courses that you could take just to kind of keep you in the loop. But it's a lot of you sitting on your own again, having the patience to again like do what you need to do by like waking up every day and studying, and then which is a little bit difficult when you're part of a program, when you're part of the classes, you have to go, it keeps you together. Here was more alone studying, which ended up can have its challenges. Yeah.
Right. Did you try to find somebody else that might be studying the same thing and just kind of be study buddies together?
Yes, and no. It's easier to find a study buddy when you're in school, but when you're like an adult, like everyone, when you move here, everyone is in a different place. There are some that are already married and have kids. There are people that are like, we're just fresh grads like me, young and single, living with family. Like there is
not anymore though.
Yeah, and then everyone is, because like we don't all go to the same school, so not necessarily we're all close to each other. And Vancouver, everyone is like 45 minutes away from each other, everyone living in a different suburb. But it's what was good is that like the material was not new material, it was more like a revision, and it was I at the time was in a relationship, so I had my person that I could lean on to, so that was very helpful, having that had my wife back then. So that was really good.
That's nice. So you guys moved back here together.
So no, actually, this was before she moved. Like after that, after I started working, and then we got married, and she moved here. Yeah.
So a lot of doctors, or actually the route that I'm taking is, I get a residency in the States, and then my personal goal is to eventually come back to Canada. From what I've read, is that a lot of doctors actually when they come back, they practice rural, somewhere up north, before they actually come down to the city. Did you have a similar experience to that?
Yes, yeah. So as soon as I got my license to practice here in Canada, I was looking for basically any job in Canada that would offer this like full-time. And it's hard to find a full-time job in the city, especially Vancouver being super saturated.
As a new grad, it's hard, or hard just in general?
It's harder even as in general. Most of the job postings are 2 years experience minimum. But when I had an opportunity to go work in the Yukon, Whitehorse, and that was because they needed like a full-time dentist, and new grads were welcome. So I went there, and that was really nice because it was a good opportunity because there is a demand for your role there, and it was a very nice way to kind of get good exposure, good work, and it was a very nice place. People in Whitehorse are like Yukoners are very nice people, very welcoming. As soon as you're in the territory, you're considered one of them, which was really nice. So I would do it again.
How many hours away is Yukon from here?
It's a 2-hour flight.
2-hour flight.
Yeah,
okay. And it's quite cold up there, right?
It is cold, yeah. It's cold. It's Canada, so it's super cold, and it's north. But you learn to like live. People have lived there ever since. Before. So now having our services, you could make certain changes to be more comfortable there. Of course, it has its challenges, but I felt like I was there again for a purpose. I needed to do something. I needed the experience. So then your setting ends up becoming secondary.
And how many years did you spend in the Yukon?
I stayed there 3 years.
3 years. And with the goal of coming back to Vancouver eventually?
Well, the goal, when I went there, my goal is like to go there until I see a different opportunity or a different, So it was a little bit, it allowed me to, when I go there, really kind of settle in there, because whenever you go somewhere and if you think that you have like a to-go ticket out, I feel like you won't fully be there. So I went there as if like, you live as if I'm gonna live there for the rest of my life. And once you do that, then you settle in a much better way. You feel more at home, less chance for you to feel like homesick,
depressed. And
because if you always feel like, no, this is not my place, I'm always gonna, the goal is to go there, like tying certain achievement or happiness with something that is about to come, which may not come, because like opportunities come and go. So, but an opportunity presented herself to get to come and work in this clinic that I'm currently owning as an associate. So I'm kind of got lucky with a really nice
I'm glad
opportunity.
It worked out.
Yeah, it's nice to be back in Vancouver for sure.
Do you have any memorable patient experiences up in Yukon?
In the Yukon, I saw a very similar taste to what I was when I mentioned about like how things were back home with my dad and seeing people from a smaller town, how they are. There was that element of gratitude. There's a lot of areas or communities that are underserved when it comes to healthcare, or especially dental care. So when I see people that are like happy to come to a clinic and then come back another year and they see the same face, that there's not a big turnaround, it's nice to kind of, and it's there I feel like people are more like say the truth a bit more. So if they see something kind or say something good, then they would communicate that. So getting that nice feedback or is the mess, like things that you'd always like remember. You'd remember faces from necessarily what they say to you if they say something nice.
And
Yeah.
does that differ than like here in Vancouver? Is there a big difference?
The difference is here in like dentistry has like there's a price with it. Every visit has a price. So I feel like lots of people when they come in, if you've given them a great service or like even if you've like checked all their marks, but then there's like a bill that they have to pay, then there is a big feeling that okay, well, like my money got me this service. So the gratitude is like not necessarily like even if they feel good or they were served well, they feel like they owed this good service because they paid like prime dollars, like a visit,
yeah,
like if you're
yeah.
paying hundreds or thousands or all of that. So then the gratitude element isn't necessarily like it could be there, but it's not always with every transaction. And it's basically even if you were to go to a coffee shop, but then if there's that one coffee shop in town where their lattes is $12, when you walk in, when you get it, like there's less chance for you to thank the barista because you're paying 12
Yeah,
bucks. So
yeah.
this needs to be good. Like every sip
Yeah.
needs to be perfect. So I feel like with how even in the last maybe decade how dentistry and the price in dentistry have gone up, or like insurances are not catching up with the inflation where everyone is paying for it, then then I feel like it's more of a transaction. So that's kind of I feel
So
like
there's
the
like
difference.
the relationship is a little different than working in the Yukon.
Yes, and then when I was working in the Yukon, there was a lot of people that had full coverage, either through like government benefits or through like work benefits, where like they always don't have a big like payment portion. So then if it's a exceptionally good experience, or if they had something like better experience than they had before, they're more likely to say something about it.
Okay.
Yeah.
And so you came back to Vancouver, and then now you own Broadway Smiles here. Is it difficult to be an owner rather than to just work at a clinic? Like, how hard is it to actually run your own practice?
So it's basically two roles in one, and you have the same amount of hours in a week to do those two roles. When you're a patient, like working with patients, there's like when you're sitting by the chair, they like the procedure is taking your undivided attention. So if I am booked in a certain day, procedure after procedure, there is no time for you to do anything outside of that. And then there is like the outside of the dental chair, for the same treatment, for the same work, there is like the work or the planning you do before, whether it's, I say, like the Invisalign cases, implant cases, there's a lot of like planning that goes before that time, and then after that there is like the following up, talking to the patient, making sure that or managing complications, all of that. So that alone takes your time of the week. And then as a business owner, although I'm very lucky, I have a great team that I've delegated a lot of tasks to them, and they own a lot of the tasks. You're still, as the business owner, because your name is on the front door, you're thinking at the same time of like big picture, like where do you see yourself in a few years? How are you going to grow? How you don't want to stay stagnant. Then so there's all these other kind of things that you need to kind of worry about or think about at least. So that it's more about like you're thinking about your job a lot, more things to do. So that's why sometimes it's more of a around the clock work. But I think that's any business that you own,
right.
You're thinking about it on the clock. So then there is off the clock and on the clock tasks that you need to do.
Do you do anything outside of work?
Yeah, I try to do a lot of like some my things that I like to do is some sports, some like things to kind of stay fit, and then play squash, some learning tennis, like stuff to. We live in a very lovely area, so just kind of being outside and doing all the things in here it keeps you busy.
We're lucky that we live in Vancouver. I feel like we have we got the beach, we got the mountains,
Yes.
snowboarding in the winter, we got, indoor, outdoor soccer fields,
Yes.
basketball courts
Yeah.
everywhere, good food options as well. So it gives us all these opportunities to actually pick something up out
Yes.
of work, and
Yes.
it's very important for your mental health. Now let's get a little bit personal. So growing up, I've had a lot of dental issues, right? And my parents would always take me to the dentist. And I think actually one of my first panic attacks might have been in a clinic, in a
Wow.
dental clinic, and it actually caused me to run out when I was younger. And every time I have to see the dentist, I'm always so scared. For whatever reason, dentists freak me out.
Yeah.
I wanted to ask you what are your thoughts about that? Why are so many people afraid of the dentist?
I think they link it with like it's pain. I think there's lots of people experience pain from their teeth at a young age, and like that's usually the one of the most common things to go wrong in your body or in your health as you're growing up, because there's more likely for you to get pain in a cavity or pain from like a tooth hurting than having like body aches or internal organs hurting you or anything like that. So there is that. You have pain, and the pain, once you have pain, there is always like the blame that you did not take good care of your teeth. So there is like a little bit of shaming or like blaming that you're in this because of your neglect. And then you go to the dentist, and then you're going to someone as you're a kid, you're scared, you're non-cooperative, and then you go to like a professional that might be good with kids and might not be with kids, and so there's a lot of it's all linked with, it's not a good time
Yeah.
to be a dentist. You're also like there is pain, or there's like you have to endure pain in order to treat something. Kids are not good at communicating, so if they're scared or if they're not numb, then they can't communicate that a little bit lack of patience from dentists. Patients, like dentists, are notorious for not liking to work with kids, or are because it's first of all, it's a very difficult thing. You're working on a
Right.
moving target, and it's not profitable.
Really?
Working on a child is not profitable, because the most you could do is like a filling, all of that. So it takes you a long time to do something small. So then from the dentist, they might not provide the best option as well. And this is more kind of like traditionally, and like when it was more, dentistry was more on a community level. I'm not talking about the pediatric dentist, or now dentistry is very consensual. They always take permission, and we're learning more and more to kind of give the patient or the child more ownership in the chair. So there is that part of it, and then I think it's the same with like being scared of cops phenomena, when you're like your parents sometimes would threaten you with the dentist.
I've had that a lot.
Yeah, and so it's just like with the cops. Like when I was like a child, or like the cop is someone that my mom or a mom would threaten a child.
I'll call the cops.
Yeah, I'm gonna call the cops on you, or with the dentist. So there's a lot of that. So, and then sometimes if this is the first time you're exposed to trauma or fear or pain, and it's actually hitting, and then you see your parent, which is your protector, is sitting next, like idly there, while this
just watching
person is hurting you, or just like telling you it's okay, you just have to do it, or we're here because it's your fault. There's a lot of that, and then so that sticks with you. Like
Right.
I don't see it anywhere in healthcare. Like when you go if you have bad eyes and you go into an optometrist, like they don't hurt you to get you glasses or all of that. And if you have something else that's going on, say you have like problems elsewhere in your organs, there's a much more like empathy in that part, and like they treat it better. I think with dentistry, lots of people think like, well, just like endure it, because I'm just here for 15-20 minutes, let me do my thing, and then it will be better. But so I think lots of people kind of take that and it carries. Carry
lifelong.
With it. Yeah.
Do you have any advice for somebody that's raising children, and how can they not have that effect translate onto their children?
So I would introduce them to the dental setting not when like when they don't have any problems. Take them to the clinic just to kind of get a checkup, or take them to the clinic to get their cleanings, for them to be comfortable with having someone like touch things inside their mouth. When it's your first time going to a dentist and you already have pain, that's not a good idea. And that's why we advise our kind of young parents to bring their kids when they're young as well, like around 2 years, for them just to kind of, so it's just a place for care rather than it's a place you go when you're in pain, or somewhere you go where you go. And also like for them to kind of like, for parents to kind of communicate of what this could be, and it's that it is something that if the child gets to communicate that there's like to kind of that it's something that you go together through and like kind of hand in hand, and then that there is like the dentist gets to kind of explain to them what's the procedure, all of those kind of things, it ends up they ease into it. So, but then I build a trust and rapport with this child. So then if I tell him like I'm gonna do this, it's going to hurt, but it's better than like surprising the child. Or I never slid in the needle into a child. I show them like this is what's going to happen. Yeah. But then I'd be like you got your vaccine the other day is going to be the same as the vaccine.
Yeah.
Look at this gel. I feel like with the showing a lot is good, and like the reward system when they do something, rewarding them, even saying good job, this is so great, like that words of affirmation really helps as well. So I think the best thing would be to come to the clinic just to kind of be introduced, going to the same clinic, so choose the clinic that works best for you. And then that comes, so if there is an incident where you do need to do more work, then there isn't that element of where am I, unfamiliarity, all of that. Then it's more like you're familiar with the setting.
Okay, so early exposure, bring them in,
Yes.
Let them walk around, let them maybe not touch the tools, but
yeah, no, the more they are exposed, I feel the better.
Okay. So you're open that like if there's someone watching right now and they have a child, you would be okay if they brought their child to Broadway Smiles?
We have the appointment is called spin in the chair.
What is
so
that?
we just basically spin them, like put them in the chair, kind of like spin them around, like have them like lay back, go in. It's
nice.
like you sometimes the first visit, sometimes I might not even look inside the mouth. If I see like the child is clenching or all of that, like that's all, like for them just to see me and all of that. So that's why it's nice. You get to just kind of it's like visiting the fire department. You're just going walking around.
Just watch. That's awesome. I didn't know that you offered that.
Yeah.
I would have loved to have that exposure when I was younger, but unfortunately I didn't, and now I'm terrified.
But you're just not comfortable at the dentist yet.
Yes. Before I ask you the next question, I just want to make sure that everything's good. So besides children, what are the most common conditions you see patients for? What do they usually come in for?
So I live in a place that people have pretty good dental IQ. So people take care of their teeth here. They're on a good diet. They're on a good oral hygiene routine. The biggest thing that I see is functional problems, meaning like how their jaws meet, how they are chewing. That I see that more. So I see more teeth breaking, fillings failing, and it's not because they have a caries challenge. It's mostly because of the certain way, if they're the ways that their jaw has kind of grown and over time and shifted, or if there's a little bit of misalignment, a little bit of breakage that's happening in one area. I see that the most.
Really?
Yeah.
I would have thought you probably saw cavities the most, because that's every time I had to go to the clinic, I mean, to the dentist, cavity, cavity, cavity.
Yeah. So I think because of having dentistry and dental visits part of the culture where you're routinely going twice a year, regardless if you have pain or not, you're getting your cleaning, you're getting your checkups. So if there is something that is going on, if it's cavity related, you will have that within like your early adult years, and then you could then link that you're getting this cavity mostly because of certain habits that you're doing at home that are not working out. So lots of people correct the habit early on.
Okay.
And again, it's because there is that education about dental care, and it's also in the school system. So at least in this part of the city, it's not the biggest problem.
Okay, that's good to hear. What is a cavity?
So a cavity is basically your mouth. The environment in the mouth is not great, which is allowing your teeth to decay.
Okay.
And what's feeding this decay? It's either too much food, leftover food hanging around the teeth, too much acid, so the whole environment in the mouth is acidic. And basically teeth are kind of like stone, like limestone. So if you're putting it in an environment this environment is bathing in saliva, which is your spit. If your saliva has a lot of bacteria, good bacteria, part of your oral flora, but if that saliva has more food to munch on, to eat on, you're putting it in a prime environment, acidic environment to go in, then it will just increase and get bigger and get bigger. So usually if you have a cavity inside the mouth, it's more of a mouth disease rather than something is wrong with that tooth.
Oh, interesting.
Because it's so like chronic. It takes time. You know, it takes a while for the food to be there and the bacteria to be there for it to slowly kind of pierce through. You know, the cavity always comes from outside and it's piercing through. So that's why the most common areas is either in between the teeth. So if you're not getting in there to clean, or it's usually from the biting surface. You know where we have those grooves on the biting surface? If that is like that groove, lots of food is staying there, then that's also like an entryway into the tooth.
So the food stays there and then bacteria come and eat the food, and that's what causes the acidity?
So the bacteria eat the food and they increase in number. And as soon as when they increase in number and they eat the food, that whole digestion of their own bacteria releases an acidic substrate. And that adds a little bit more. That acid is basically what breaks down all the calcium and the phosphate crystals that are from the outside of the tooth, and it just kind of pierces through.
And when you're looking into their mouth, you actually see like a hole in their tooth?
You would like so you don't see, no, usually like if the first is just like, it's kind of, you know, you have the apple and you have the worm and the worm is like inside. You could still see the apple is all like intact, but if you open it, it's like a hole inside.
Right, okay.
So there is an entryway. Once the cavity is really big, then because it entry mines and we keep on chewing on the tooth, then the actual tooth breaks, so then you could see a hole. So because I'm in a preventive part of dentistry, I'm like looking for early signs of cavities.
What are some early signs that you look for?
So early signs of cavities, some discoloration in the outside of the tooth, and there is also, once it kind of, we also use imaging, like x-ray imaging, that also helps. Because symptoms is a late sign of cavities. If you're already like drinking something cold and it's hurting you, that cavity is deep. It's already deep.
And besides, drinking cold water and experiencing pain, are there any other symptoms for having a cavity?
So it's to temperature, cold temperature, and it's to sweets actually. Yeah. So if you eat something sweet, then you'll have this like lingering, because sweet basically, if it's like if fructose or sucrose, which is the simple sugar, that's the ideal food for the bacteria. So then if you eat something, then you're giving like that. Like you're giving kind of like an energy shot to the bacteria.
Like a buffet.
Yes, exactly. Yeah. So that's why things that are more like chocolate is not the worst thing that you could eat for cavities, because it has more of a fatty layer. it takes longer for it to digest. But if you're having like gummy bears or like acidic drinks, then that's worse. You'll feel it more.
And why does drinking cold water cause the pain? Is it something to do with like as the tooth decays, you're getting closer to the nerve?
So I think it's more on a more cellular level, the change in temperature between like the substrate inside the mouth, outside the mouth, allows certain kind of hydrodynamics in the tooth. There is like the sub-level of the tooth, the dentin level, it has like little tiny tubes. So changes in that temperature, kind of the changes in the temperature might allow more movement in that levels, which will get picked up by the sensory nerves inside the tooth. So that's why it's a little bit, it becomes more of a trigger or stimulant.
Makes a lot of sense. Okay. And I've always heard the term root canal. What is root canal? What does that mean?
So root canal is basically a cavity has gone in too deep into the tooth that it actually goes to the inside of the tooth, which is the pulp is what we call it, which is the room that is inside the tooth that houses the vessels and the nerves. So when it goes into there and the bacteria, because it's like as the hole increases and gets deeper into the tooth, it is getting like the bacteria is also traveling inside the tooth as well. So when it kind of reaches towards the nerve and it walks into the nerve and the bacteria now enters the bloodstream or the blood system of the tooth, then the tooth is compromised. So you do a root canal to basically open up the tooth, remove all of its internal kind of vessels and nerves and all of that, and pack it and like mummify it in a way.
But if you're removing all the nerves and the blood supply, that doesn't cause the tooth to decay even more?
So the tooth is clinically dead. It's not alive anymore. But at the same time, because you've removed the cavity, and then you put like a good restoration or like a crown on top of the tooth and kind of like seal it from outside, seal it from inside. There is, of course, if the habit of having food around it, like a tooth that is root canaled isn't invincible to decay. You could still get decay, but typically once you do a root canal on a tooth, you also put a crown on the tooth, and that's why then you could preserve the tooth.
Is a crown that silver thing that they put on the tooth?
It's a gold or yeah, it's like a full kind of hat that the tooth wears.
Okay.
Yeah, but again, you're not making the tooth stronger. You're basically trying to like salvage the tooth. So a root canal is something that we do in order to allow for us to not lose the tooth and remove it. Like we do a root canal.
Okay. Believe it or not,
yeah.
Sorry to cut you off. I think I've had like 4 of those crowns that you're talking about.
Oh yeah.
I've had a very terrible experience with my teeth.
So far.
So far, yeah. We're gonna change that. We're gonna be coming to Broadway Smiles. You said 2 times a year, right?
2 times a year,
2 times a year, okay. You mentioned that cavities are mainly caused by sweet things.
Yes.
Would you agree with that?
Yes.
Do you love sweet things yourself?
I love sweet things.
And what do you like? You love sweet things. I'm assuming you indulge in a lot of sweet things. Are you afraid of getting a cavity yourself?
So I love sweet things. I love like Eastern sweet things and Western sweet things, and I feel that you could eat whatever you want. I'm promoting healthy teeth, and I think a healthy tooth or a healthy mouth can eat anything that like you put it into. It could eat the crunchy, it could eat the hot, it could eat the sweet. If your teeth are strong and healthy, then you get to be able to kind of endure that and munch on and eat everything. So if you were to do what you're supposed to do to clean your teeth after you eat something sweet, then why not? Like then you should. But that thing is like I indulge, but don't overindulge. Like I'm not eating kind of constantly. Like it's not a box of chocolate that you eat it all. I think it's again 3 things that we talked about. Kind of what makes the cavity. You need the food, which is the actual like the sugar. You need the bacteria, which is already inside your saliva, and you need time. If you leave the food there and you need all those three things in order to make the cavity. So what I'm no matter if I were to eat stuff that are sweet, but I'm removing the time, meaning that I finish something sweet, I kind of rinse my mouth out after, or that same night I'm flossing or brushing, then those three things haven't been met, so then the cavity does not go. So then I enjoy what I like.
Nice.
Yeah.
What's your favorite dessert place?
It depends. What do you want? Like, if you want donuts, I like Mellow. Mellow is really nice.
I've been there. It's really
yeah,
good. Yeah,
it's really stuffed. If you like cookies, which is a newfound Fresh Street Market, which is like a grocery store, they make really nice big chocolate chip cookies. If you like pies, the pie hole is really good. We're so lucky we have so much.
So many dessert options.
Yeah,
I love it.
Yeah.
I don't love the cavities that come after it though. So do you just? Actually, we'll move on. What's a mistake people commonly make with their dental health that drives you crazy?
So, I think the biggest thing is that I feel like lots of people have been taught certain things growing up about how to take care of their teeth, and usually you learn that from like your own household, your own parents and all of that. And for them not to kind of take on new like methods or new advices, and basically listening to kind of the advice that's given when you come in to see the hygienist or the dentist. And usually the most common mistake that people do, they think that brushing is enough, and brushing does like cleans at most maybe like 50 to 60% of the surfaces of your teeth. So you gotta find something else plus brushing. Flossing, anything that will clean things inside the teeth, whatever works. Flossing, water flossing, using interdental, like picks that go in between the teeth. You need to kind of think about it like if you had, like say if you were to do any gardening and your hand is exposed, you're going to, if I'm just come and I scrub the outside, this side, like that, you've scrubbed in for surgery, and you've seen the steps. You've seen that you have to take on first like the whole hand, and then you go in the whole finger and all of it. So you're basically, it's as if you played with this, you did all this gardening, but you didn't clean in between the fingers. Your toothbrush won't be able to clean in between those surfaces. So that's kind of where like it's a little bit you're forgetting about a big chunk of your teeth that aren't really being cleaned well. And that's usually the where all the problems happen.
Okay, so flossing is very important. I hear that at the end of every dental visit, and I go back home and I try my best.
Yeah,
I try my best.
It's a habit, it's a habit, and if you want to take it on as a habit, it's kind of like if you want to read half an hour every day, or you can't start with the goal. You have to make it more like calculated, time-based, all of that. So you start slowly. Start by choosing one weeknight and one weekend night, and then until it becomes more of a habit. And I think people, if you're kind of anything you want to take on seriously, if you kind of see where your challenges are, find out where is the best time for you to do it. It's doable.
Is there a certain time of the day where we should prioritize flossing?
I would, if the best time is to kind of not go a very long time with keeping things in between your teeth. So for me, it would be like if you've had, the best thing is before going to bed. It would be good. So just so that you don't spend 8 hours. Sometimes your mouth is open or closed in your sleep, and if you have like something lodged in between your teeth, there's a higher chance for the bacteria to do its thing. But then again, everyone needs to know more about their own mouth and where areas in your own mouth need a little bit more care. So say if you're missing a tooth or you have a little bit of crowding, there are some areas that are harder to clean. So areas that are harder to clean need more care because they're harder to clean, but they're also easier to get to be not clean. So kind of knowing that and a little bit more about your yourself, and that's again what you gain from coming to the clinic
Yeah.
twice a year. Because if someone is in a very nice way telling you, by the way, this area is not doing okay, and then you learn, and then you find out that you need to do some work on that tooth, or that tooth needs to come out, then you kind of believe that certain things that not everyone has their they some people need more work or more care in certain areas, and it also depends on your own genetic composition as well. Like some people have a higher number of like bacteria in their saliva. Some people already have even the quality of your saliva. Some people have a very more drier mouth. Some people have a more wet mouth. All of those areas makes you either more prone or more vulnerable to cavities, or more resistant to cavities. If you're your diet is one of them, but even your own teeth, if you have a lot of spaces or a lot of crowding in between your teeth, or if you have like if you're a mouth breather, if you're taking some medications that's causing you dry mouth, all of those, whenever the environment is altered, that will in some way make you either more prone to problems, which means that you need to kind of address that challenge in the best way.
A lot of people with sleep apnea sleep with their mouth open, and that causes them to wake up with very dry mouths. Do you think that increases the risk of cavities in those individuals?
So with this person, if you have sleep apnea, or you had to breathe throughout the whole night, if on that day you haven't brushed well or flossed well, then you're basically, whatever is inside your mouth gets the chance to adhere to the surface of the teeth even more. Because it's sometimes our wet saliva, our tongue, our lip wipes our teeth, keeps it in the self-cleansing spot. But if you're suffering from a dry mouth, then the whole environment becomes more helpful for bacteria to do their thing. Lots of, about the bacteria, I'm pretty sure from your sketchy micro days, aerobic and anaerobic bacteria. Anaerobic bacteria are much more harmful, so then there's a higher chance for you to get like gum disease, and for that disease to be more rapid, a higher chance for it to progress or be a little bit more irreversible. So anything that affects the health of the mouth can make you more likely to face problems.
Now, you mentioned a series of things that could go wrong. What is the golden formula to having the healthiest teeth possible?
So the golden formula would be, of course, doing your diligence in kind of keeping the area clean. If you were to indulge or eat more food, like knowing what are bad foods for your teeth and good foods for your teeth. So if you're eating more bad things for your teeth, for you to take extra care.
What's a bad thing?
So the worst drink you could drink for your teeth, it's Mountain Dew.
Really?
Yeah, because it's acidic and it's bubbly and it's sweet and all of that. So if you're a Mountain Dew,
I used to
drink,
be.
Yeah, so that makes more.
Maybe that was the issue. I drank too much Mountain Dew.
Yeah, you're in the dew. Yeah. So knowing where you are. So, but the formula, I think, honestly, would be to come, to get your teeth health checked out regularly,
Okay.
and then that way is because you could know, it's like a reality check of if you're doing well or not, and then you could find out if you were gifted good teeth, or no, you've your teeth genes aren't the best. There are some, your bone quality or joint quality, sometimes we have some limited kind of genetic potential.
Right.
So coming and checking out, seeing your teeth how they are, you get to know, am I doing good or am I bad? It all depends on how, when your teeth were developing, was there fluoride in the water? It goes back to when you were in the womb, were you well nourished when you were in the womb? Because that is what makes the composition of your baby teeth. But then when you're as soon as you're born and once you're 1 year old, that's when your adult teeth start to grow. So were you ill when you were younger? Were you less chance you had problems eating or all of those? So that makes you more prone, your teeth are stronger or they're not. So if you drank a lot of milk or you didn't, or if you had allergies or you didn't, all of those kind of things. So when you come in and you get your teeth checked like frequently, you get to kind of know what is the best way to take care of it. And I think that would be the formula, is just like the routine checkups.
Routine checkups. And is
Yeah.
there anything we can do at home to have better teeth?
So that would be like to like not, yes. So it would be kind of taking care of your teeth.
Brushing,
You have the brushing and the
flossing.
flossing, and being able to kind of like knowing where to kind of limit all the things like
Okay.
that are bad for your teeth.
And mouthwash as well?
So mouthwash, make sure it's like what kind of mouthwash it is, because like there are the most commercial or the mouthwash that you see, they're not necessarily like good for the mouth. They might have an ability to kind of give you that fresh minty breath, but I wouldn't trust every kind of component in them
Really?
if you've done your research and you know where it is. But we're talking about acidity and how bad and acidic, having an acidic environment. Some of these mouthwashes are acidic themselves.
Now that I think about it, when I do mouthwash, you do feel very,
Yeah, exactly.
that feeling as if you're drinking Mountain Dew sometimes.
Exactly. So if people use a mouthwash as one of their go-to, it's kind of like you putting on deodorant versus showering, you know? Like the mouthwash might give you a nice, if you use it to complement your oral hygiene routine, then that's great. But lots of people are like if they're too lazy to brush or floss that night, then I'm just gonna rinse with mouthwash. That won't even not necessarily help, or might be making things worse if your mouthwash isn't a dental mouthwash or like a dental company that has made the mouthwash. Yeah.
Okay. And how often should someone brush their teeth?
So the most common would be like twice a day. So I would do it maybe like after breakfast and then after dinner or the last meal you'd eat. But then again, if you're a person that you think that even if you're doing the brushing and the flossing, and then when you go to the dentist you're still getting cavities, and maybe you would require more, I would maybe introduce it after like a lunch meal as well, to go to 3 times. But 2 is usually the average recommendation.
And is there a correct method to brush your teeth?
So when you're brushing your teeth, you're basically trying to brush kind of the teeth as well, but mostly around the teeth. Like it's kind of like between your nail and like your nail bed. If you're focusing, if you do any gardening, all the issues happen around like the nail bed, because the nail is soft. It kind of gets cleaned in its way. So the soft parts of your teeth, like the round parts of the crowns of the teeth, they're self-cleansing. You know, your teeth, your lips, your tongue, your cheeks rubs against them and cleans it. But it's between like where the tooth and the gum meets, that's where most of the bacteria would hang out, or the food debris, or what we call plaque. So focusing on those areas, and that means that placing the toothbrush at like the margin where the tooth and the gum meets, coming in on an angle, just so that you're able to kind of sweep out that little kind
like
of
a downward
silk.
angle, like if you're
Like
doing
a
your bottom
45-degree angle. So if this is the tooth, that my top 2 fingers is the tooth, my bottom 2 fingers is the gums. The gums are a little bit outside. You kind of want to come in an angle just so that you could get into that margin.
Okay.
Yeah.
And
so always a soft toothbrush, always kind of being gentle, and like if you kind of think about it, where you really want to kind of clean the outside of the tooth more, and of course grabbing the biting surface again, because of the grooves that are on there, you want to clean the biting surface as well.
And then do you also want to do the inside? Like
yeah,
that could be a little hard to get to.
that's actually the most like forgotten or like neglected place, is the inside, especially like in the bottom inside, close to your gag reflex. Most people would like try to avoid it, but great top of the line electric toothbrush, if you hook it up to your phone, it could tell you where you're missing and all of
they're
that.
expensive though.
They're very expensive, but I mean, but that's kind of where it is, and that's I think where you might get some insight when you come in and your hygienist tells you like your teeth are doing good, but it's these gums around these teeth are looking a little bit more inflamed. So you could get to kind of decipher and find out why, because if it's in one area, then it's probably an area that the patient is missing during the cleaning, and that's kind of where you kind of you get you need to remember where to kind of go and address every area.
And do you recommend that everyone should switch to an electric toothbrush?
So, like an electric toothbrush, I feel like it's more efficient, you know, and it's like more efficient, more likely for you to do a kind of a good job in both areas. Like right-handed people tend to do much better work on their left hand side, just because you're working with your angle. But then when you kind of switch on the other side, it's harder for you to target and all of that. So with an electric toothbrush, it works. It kind of either like vibrates or oscillates in a position where it's good. So it's kind of control like your own screwdriver or a drill, you know, like.
Yeah.
So the power that you get from an electric toothbrush can get like areas where if you have more retained plaque or more resistant plaque, there's a higher chance for you to clean. Don't get me wrong, you could still do great work with a manual toothbrush, but it might need a little bit more time for you to kind of get in that area, or it might need a little bit more conscious kind of work. I personally use an electric toothbrush and I like it. Like I feel like it needs, but your technique is I think the biggest thing.
And how long should someone brush for?
So if you were to divide the mouth kind of equally in a time where like the top arch needing 1 minute, the bottom arch needing 1 minute, you kind of like split it into quarters where you take care of like a quarter of the mouth at a time. 2 minutes should be sufficient.
Okay.
Yeah.
And I think another nice thing about electric toothbrushes is they have an automatic timer.
Mhm.
Because I have
Yeah.
I have an electric toothbrush and it
Yes.
turns off.
Yes.
Like I think 2 minutes and then it
Yeah,
shuts off, which
exactly.
is nice. So I can keep going and just trust that, you know, it's going to stop at the 2 minute mark.
Yes.
Sometimes it feels like it's going on forever.
It's like it goes on forever, yeah.
Yeah.
Because most of us have been brushing our teeth since we were kids, and like we can learn a certain pattern, and like it becomes automatic. And then if you actually time yourself, you might be way under a minute, you know.
Yeah,
So
yeah,
2
yeah.
minutes goes in, but it's also a good time for you to just like disconnect from the world.
Sometimes it's like, sometimes I'm running late, turn on the toothbrush, and I'm just
Yeah.
like, when is this going to stop?
Yes, it is 2 minutes. Like 1 minute in dentistry is a lot. Is a lot.
Yeah.
Even, yeah.
Another thing that a lot of people are tapping into is whitening strips.
Yes.
Everyone wants whiter teeth. You know, a nice smile goes a long way. I wanted to get your opinion on whitening strips, and what are your thoughts about people that want to whiten their teeth? Is that a route that they should take?
So the reason why whitening is it has a beauty aspect of it. So it makes a face more attractive when there is like the teeth are brighter. That's why people seek it, and that's why you see people in like the entertainment world or the beauty world, or even like in the professional world. It's a sign, like it's nicer. It's kind of like it's a part of being well groomed or look better. So definitely there is a lot of people like that seek it, and there are safe ways to seek it. There are like commercial ways to seek it as well. And but there it is. I think it does come with a little bit of responsibility that some teeth don't do well with whitening. So some of the safe way of whitening is that we have like it's like a bleach gel that penetrates the outer shell of your tooth, and then it kind of goes into the sublayer of the tooth and breaks down these little carbon bonds and remove those stains. So those carbon bonds would be the stained. Some of the more commercial like products, they're there to just maybe like strip the outer layer. So there are like every different. So the whitening strips, I personally have not used them. I know a lot of people that have good success with it. But I do know that people that have sensitive teeth, people that can't take a bite from a popsicle, or people that can't have like when they're in the winter, they're covering their mouth because it's too cold from the cold air. If you're one of those people, maybe it just means that your teeth are oversensitive. So you're coming in and putting a very strong material on the tooth might trigger that sensitivity. So It's nice, but it has its like limitations.
What usually causes the teeth to become yellow?
So most of it is like from our diet,
Okay.
like any leftover from like staining from our like hyperpigmented foods such as coffee, tea, things that are in our like in our spices in our food. These are the things that cause the staining. A big part of it is also people enjoying these like beverages or foods and not necessarily like cleaning after them, cleaning the mouth after, so it kind of sets in. It's basically mostly from the environment.
Okay. And what's your opinion on veneers?
So veneers, like we've gone a long way with veneers, and then the materials have been becoming really good, and the way that we glue veneers on teeth has come a very long way as well. So in the past, so basically a veneer is something that's porcelain or composite, but mostly it's porcelain made in the lab comes and it sits on the facial surface of the tooth. So it is basically like a fake nail that you put onto the tooth, and it could be very nowadays very thin, and it is there to improve the appearance of the tooth. It's there to improve like the color, the shape, or the design of the teeth. If that is what like we're out for, if someone has really nice teeth, they're healthy, but they don't like if someone doesn't like the shape of their teeth, if they're maybe like too narrow or too like maybe like they're like the color is a little bit off, or maybe they're not all the same color. Maybe one tooth that had a filling, one has a crown, all of that. So it's a very good, nice way to create, like be able to be in full, like you design how the teeth need to be. So it is a very good tool on a tooth, but there's a lot of stigma for veneers, is that because there are a lot of the more older way, or the more like the easier way to prepare a veneer is just to really kind of remove like more than what you need from the tooth surface, and then allow it to be replaced with the with the actual restoration. So it gets a little bit of bad rap because of that. But lots of people sometimes have like their teeth, like their front teeth are like breaking or chipping, or they're rotating, and they try to fix it with the veneer. So that would it will fix the aesthetics, but these teeth, why did they chip? Why were they crooked? All of those kind of things. So if there's a chipping on the teeth, it usually mainly goes back to us saying like maybe it's a functional problem. Maybe the way the jaw is closed, maybe how the person chews is causing this chipping of the teeth. So if your natural teeth that you're kind of, they're natural, if they're chipping, your like a porcelain restoration is not going to make them stronger, so then your actual veneers will fall. And then so usually where like the best and preventative way for you to do is to maybe move the teeth into the ideal position, make the appropriate movements, and then if you want to fix an aesthetic issue, you could put them on.
Okay. And when you say move the teeth, are you talking about braces?
Yes, orthodontics.
Okay.
Yeah.
And how do braces work, by the way?
So braces is you're placing a low grade force on the tooth, and when the tooth is being pushed in a certain way, it starts an inflammation in the bone, and then with the inflammation of the bone would cause remodeling of the bone. So if the tooth is here, you push it on this side, all the bone that is on this side of the tooth starts to either get resorbed, and then it gets remodeled, and then you slowly allow the teeth to move. Because the tooth is in a ligament with the jaw, it's not like pegged in there, and like it's not ossified in, it's like an actual joint. So those ligaments can expand a little bit, and it slowly, because it's a low grade force, then it will you're kind of shifting things in.
Okay.
Yeah.
And is that the same way how Invisalign works?
Yes, same concept.
Same
so
concept.
You're basically applying a force on a tooth in a certain direction, in a certain kind of vector on force, in order to allow it to shift in from one place to another.
Okay. And do we still do braces, or does everyone just do Invisalign nowadays?
No, like the braces is still like it is the more traditional way, but it does the same work, the same job. People more shifted towards Invisalign because of like the aesthetic aspect of it, and it's a little bit easier to manage, less visits to the clinic, and those metal wires sometimes are a little bit more like are annoying to the inside of our cheeks and our lips. You've had braces?
Long time ago. Yeah.
Yeah. So there is that. There's the multiple visits, like the tightening, because it's you go to the dentist or orthodontist and they tighten it. Then there is like a lot of pain.
Very painful.
Yeah, and then it slowly kind of like it's not enjoyable. With Invisalign, you still go through the same kind of way. You still need to put pressure. There's still some discomfort from the movement, but it's at your pace. You're just changing tray after tray, but they both essentially do the same work.
And do they take the same amount of time?
More or less, yes.
How long do people usually have Invisalign in for?
So again, if it is something that is more like there are mild cases and there are more advanced cases. So mild cases can be done in like 6 to 9 months, and it could go up to like 2 to 3 years.
Okay.
Yeah.
You mentioned earlier that some people can chip their tooth due to maybe a jaw misalignment. What is the first thing someone should do if they lose a tooth?
So you need to think about like why you lost that tooth, and then you need to think about, okay, how am I going to replace that tooth? Finding out what caused this tooth, if it was like you broke it, or is it because of like you had a cavity that got deeper and deeper, and then a root canal and got deeper and deeper, or if it is something that was a gum issue. Because if you start gum disease and gum gets a little bit deeper, then it becomes a bone disease, a periodontal disease, and the tooth can literally just fall out.
Or something traumatic, like let's say playing a sport and a tooth falls out. What suggestions would you give to do in those incidents?
So in those incidents, of course, if it is a trauma, to secure, like to remove any pain. If the tooth is like broken halfway and the nerve is exposed, then you would need to kind of remove the nerve. But then as soon as you remove the tooth, the best thing to do is, if you have plans to right away replace the tooth, that would be the best. Replacing the tooth would be ideally the most kind of gold standard thing nowadays, is to replace it with a dental implant. If you broke the tooth and it's a little bit overwhelming with like what an implant is or what it can or what are the time, the best thing to do is remove the tooth, place bone into the area where the root used to be, close it up, and then get a retainer fabricated for you. A retainer that will basically, it's kind of like an Invisalign tray, but the area where the tooth used to be is filled in with like a solid like tooth, like a fake tooth that is stayed in the retainer. That way you are basically saving the space and not allowing the tooth to, because what's happened is when you lose the tooth, it's kind of like removing a book from a bookshelf. Everything collapses. The tooth in front of behind it wants to kind of reach into that space. The tooth in front of it wants to go in. The tooth that you're biting on wants to kind of all shift in that area. So to prevent this misbalance or imbalance to happen in your tooth, the best thing to do, if you don't want to take action to actually replace it, would be to put bone where the root used to be, because again, the bone, because now it's not holding a root, it could collapse. It could really resorb, and that makes it difficult later for you in the future to have the tooth replaced, and also to have that retainer that's supposed to hold that space, just so that you would wear it only at night, that retainer at least. It's just the tooth doesn't get to kind of shift into that area.
I've also heard people say that, let's say you're playing soccer and you fall, you hit your teeth on the floor, and let's say one of your teeth come out. They say you should put it in milk. Is that a myth, or
no? It's actually good. It's true. It's basically if the tooth, like say the full tooth kind of came out, there are little cells on the ligaments, and that cell, you don't want that cell to dry up. So dry up, get dirty, put in your pocket, all of that. So milk is kind of similar to like saline, like saline. So if you have saline, great.
Okay.
But milk is good. Even your own saliva, like if you kind of in a little kind of container have your own saliva in it, at least if there are little cells in there, for them to not die. This is just with the hope that when you're going to kind of, if there is a way for them to kind of put it back in, then that may increase the chances for like the tooth to kind of magically kind of be alive. There's a high chance every time. Sometimes even if you don't lose the tooth, a big impact might cause the nerve to die anyway. But it's not a myth. Like have it like putting in milk, especially with young kids, children, and all of it, because a child after starting from 6 years old, like all of your front teeth are your own. Like for life, you know. So if you there is like we do see sometimes if you go in the same time right away back to the dentist and the tooth was healthy, basically it's kind of like putting it in, like putting an organ in ice in a way. Like it stays alive, doesn't get a chance to dry out, all the fluid stays in. So always keep some milk next to the soccer pitch.
So you recommend, let's say in an instance that happens, bring the tooth to the dentist?
Yes.
Okay.
Yeah. Okay. Even if you lose like a portion of a tooth, like a big portion of the tooth breaks off, sometimes you could at least glue that part.
Oh, really?
Again, you're not making things stronger or make like, this is at least just to maybe be easier to treat the trauma, and then again, if all situation helps and like there's a chance for you to kind of have less of a like a easier outcome in the future to actually fully repair or treat the tooth.
Okay. Just a question here. What's your favorite dental tool?
So I have a scanner, an intraoral scanner, and I think that's my favorite. Shout out to iTero. That's the company that has the scanner. It basically takes a full video of your mouth, and I'm really able to show the patient like what's inside their mouth, and that being a tool, like it's a very big communication tool. And basically then, because I could with my own mirror can see what's going on, but it's so hard to explain to the dentist to the patient what's going on,
because we can't see it ourselves.
Because you can't see, you could only feel it and you could only feel. You can't feel all of your teeth or all the sides or the surface of your teeth with your tongue even. So I find that a very powerful tool. So
is it like a tool that you said 3D scans your teeth?
So it's a camera basically. It takes shots and it builds up a 3D model. So and then it's very visual. Like there's a color vision as well, where you could kind of see things in a very realistic way. So people could. Then they have a little bit more ownership of, know a little bit more in the situation, so they could kind of, it makes it easier for them to know why their teeth are behaving in a certain way, or why a certain procedure is working out, or it's failing, or
I don't even know why I'm pretending like I haven't seen this machine, but on my first visit, they actually did use this machine on me, and I loved it because I can see while she's scanning my teeth, like they're popping up onto the screen right next to each other, 1, 2, 3, and then it just showed the full image. You're able to zoom in, zoom out. It was really nice. Yeah, I feel like I get to share my view with the patient, and that's very powerful when you're trying to reach to because sometimes you need the patient's input to kind of help you find out what's going on. So it is a very powerful tool. What's a common misconception about dentistry that you wish people understood? So I feel like dentistry is like the biggest misconception, like that dentistry is expensive, and I think it's neglect that's expensive, not dentistry that's expensive. And that's kind of, if people kind of understood that and understood how, like the power of like not addressing certain kind of bad habits, how detrimental, how it really harms the teeth, I think that would kind of help people kind of own more about their oral health. So it's like it's in your control. If you just fix your habits, then you only have to visit the dentist twice a year and not once a month.
Oh yes, exactly. Yeah, and I think also it's a big the biggest misconception is that lots of people think that it's like it's as if like you're dealt a certain set of like cards, and then like you there's like I'm the kind that gets cavities, or I'm the kind that my gums bleed, or like sometimes lots of people just kind of surrender to where their health is at. And it's kind of like anything else in your health. If you have a challenge with like with airway breathing or obesity or anything like that, if you just surrender and say, oh, I'm just I'm that kind of person, then it's then you can't do anything about it, and you feel helpless, and you just kind of go through the course and just not. But then once you think like, no, actually maybe you've reached a certain point in your oral health that it is at this point, but once you know that it's from habits or it's from like functions, maybe you're like the way that your jaws are, it's affecting you having nasal constriction, giving you mouth breathing. Like there's, once you kind of find out there are reasons why everyone is, and if it's true that you're just have bad like genes, or like genes that are not bad genes, but genes that are makes your teeth more vulnerable, then at least you would know that you need to maybe take double the work than the average person. So maybe 2 minutes is not enough, or 2 times a day of brushing is not enough. Maybe you need 4 times a day. Flossing maybe once a night is not enough. Maybe you need to floss after every meal, So like that's kind of being a little bit, once you surrender that this is who I am, or these are my genes, or all of that, I feel like that kind of becomes an obstacle for you to be better.
And it saves you a lot of money at the end too, right?
A lot of money.
Yeah. What do you consider to be your greatest personal strength, and how has it shaped your journey as a dentist?
So I think the best thing that I am good at, I think, is explaining to someone like the kind of the reason or the consequences of what's going on. And I think that goes back to like university years. Our university, our exams are like semifinals or finals. They were all oral exams. So the whole curriculum is put in spread out on like 50 topics or 50 cards, and when you go to your exam, you pick out 5 random cards and you talk about this topic. So you pick up that card, and then you have to present. You have to go in. So you basically have to someone that is an expert, which is your examiner and the professor, you have to explain it to them as if like they're a 5-year-old. And I think with that, being under that kind of, when you have people looking at you and you have to kind of explain things to them, it gave me a little bit more like kind of a little bit more, I'm more comfortable to talk to people, because my patients, some of them are like more like a little bit older, more respected in their fields, or they're all adults, they're all like professionals and all of that. So for you to take that and explain it to them in a non arrogant way, and it's not like talking down to them or not condescending way, and that's where, and then I do most of my clients are very well educated people, high dental IQ. They also take care of their teeth as well. But if something is going wrong, for me to take the time to kind of explain to them clearly what is going on and why it is going wrong, that really helps me deliver kind of what I need to do, and help make them make a decision to do the best, like, or make them make it easier for them to make a decision of what's the best way to do it for them. So I feel that is what really helps me, and then that's kind of how I get people to come back and like sign up for the treatment that I'm offering them, is because I take the time to explain the value in all the options, but giving them more information about every option. Then that's why when you know the problem, then the patient can make an easier decision. And of course, because it's your oral health, it's your own health, you always want to be you want to do the best.
Right.
Yeah,
That,
you
that
want
was,
to choose
that
the
was a
best.
very good answer, yeah. Not just that, but it also builds trust once you're giving options. You're not just telling the patient, we're going to do this and this is how it's going to go, but you're giving them, we can do this, this, and this. I recommend doing this, but it's totally up to you. I feel like that really,
Yes.
it's like honest and just, you're building that connection that can last lifelong, and hopefully they, keep up with coming and visiting you because of that. They feel comfortable. They trust you.
Yes, well, it's also, I personally, when I go to the car mechanic, because I don't know anything about cars,
Yeah.
basically I'm just hoping that whatever they're recommending is the best, and I'm so, but if the actual car mechanic takes the time to explain to me or showed me like my radiator or anything is how it's bad and why is it bad and all of that, there's more chance for me to be a little bit more involved.
Right.
And because most of the most of my work is that I'm explaining to people procedures that they need to do, but it's not, they haven't understood fully, or they don't feel that they need to do it. Most of when I look at it, because I'm like a little bit more preventive, more proactive, so I'm suggesting something. I'm suggesting something for a tooth before that bad day comes to that tooth. So it does need to take a lot of time, and I need to kind of explain a little bit more about it more. Because if you're in pain and you come to me and I'll give you, this is the solution for a pain, you're more likely to subscribe for it and go for it. But if you come in here for just you think it's a good day of just going for a clinic, and then I come to you and I look in the mouth and I'd be like, you have to do this. This is going to take this many appointments. It's going to take this many needles, and it's going to cost you this much. That's a very difficult conversation in today's economy and any economy, and also again, because of people don't like being at the dentist. So I am basically trying to convince them for something that they don't really know that they need. So I need to take all the steps in order to explain to them, like we want to it's prevention, and then if you're you need to believe it more for anything prophylactic that you do. You need to believe that there is a chance for the actual doomsday would on that tooth would come. If you don't believe that, or you don't understand what's going on, so that's where I find it when you kind of take that time and explain, there's a higher chance for them to be reciprocate with you.
Because when you're talking about prevention, I feel like a lot of the patients haven't actually gone to the point where they're experiencing symptoms, and so if you're not really experiencing symptoms, they don't want to do the procedure.
Yes.
But I feel like what you're trying to say is you're trying to be as open and honest with them so that they understand where this could lead down the road, and it's better to fix it now than waiting and having all the symptoms and all the needles and all the cavities.
Exactly, right? Yeah. And the biggest part is that because they're making the decision, they're not pressured to make a decision, right? And I also, when I'm presenting it, I also present it in a way that basically I don't need them to do this procedure. I am there to offer that procedure if they choose to go for it, If you're in pain and you need to do something about it, then you're basically, your hands are tied, you have to go with what I say. But when I'm approaching you, when everything is calm and everything is good, and I go in through there, if I were to explain to you the benefits of it, and if you've maybe had a similar past experience of a tooth breaking or doing a crown and the crown did not work, or all of those kind of things, then you're more likely to do it. I find it easier with someone with an older patient that has had a root canal before. If you've had a root canal before, and I warn you or forewarn you that this tooth might need a root canal,
you do not want one.
There's a higher chance for you to go for it. For you to go for that procedure, all that. But if you've had sometimes the most resistant patient you'd have is the people that have had good oral health their whole life, and
Makes
never
sense.
really kind of experienced it. But then only when you really show them that it really needs it, they will do it things more needed, because there's always well, this has been the way for years and it hasn't bothered me for years. Why would I take the step right now? But again, back to if you have good imaging, you have good scanning, you take the time. It takes a lot of time because it's it's not billable time that you're taking in order to speak with them and talk to them about it. So that's where sometimes you get good traction because you're explaining, but you're also not pressuring them. And I it's anything if you're selling anything and you don't act like you're like desperate or needy to sell, then you
Yeah.
end up it's easier to get the idea across.
Yeah, yeah.
People more likely to trust you.
Right, yeah.
Yeah.
That's a good point. You know, you shared your journey coming to Vancouver, going to Iraq, and then going to Budapest. Do you feel like all this hard work was worth it?
So, I mean, every once in a while you get like a nice feedback. Someone says something nice. We do some treatments, and then they call the office and they're like, "Oh, I'm happy with this treatment." And I feel like when you get those little feedbacks, that's pretty worth it. Makes it feel like even because the it's not a like when you're in healthcare, you're not getting like all these kudos
Yeah.
all the time and again because you're in dentistry, you're intruding people's personal like space when you're working on them and all of that. So everyone comes in like regretfully comes into the clinic, or maybe not everyone, like 90% of it. So you pick that up as when like you walk in with a smile, you get like, oh, I hate being here as a response. So you absorb that a lot, but every once in a while you actually be like people understand or people like feel the value that they get from us, and and if they're brave enough to communicate that and say that, it makes everything kind of worth it. Sure.
Nice. If there's a student out there considering dentistry but isn't sure yet, what would you say to help them decide?
So I think with dentistry, it's like being empathetic and personable is a bigger asset than how good your technical skills are. Because even if you start bad, like with your technical skills, you learn that after you do a filling 100 times, or after you prepare a crown 100 times, you'll pick up, you'll better. But some stuff that is harder for you to see is are you able to be in that healthcare position? Are you being like a caregiver, or like be empathetic, explain, like be more patient, and like not be very kind of be like allow yourself to have like more if you're more likely to be putting in a position where you're helpful, if you like to give back in a way, I think that might help you decide. It's not about if you're in it for the lifestyle or how profitable is, that can be good or cannot bad. But the biggest part of it is that if you are in it because you like to help people, you like to kind of relieve people from pain, and is okay to do things like selflessly, not with like something in return, then then maybe dentistry is for you.
Okay. I've got some rapid fire questions.
Okay, let me get a sip of water.
Sure. Some of these we discussed, but I'm still gonna mention them. So the first question is, floss before or after brushing?
After brushing.
After brushing, okay.
No, before brushing. Floss first and then brush.
Floss and then brush.
Yes.
Okay. And what's worse, drinking coffee or soda?
Soda.
Soda. Okay. Best and worst foods for your teeth?
Best food for your teeth, it would be like raw vegetables, like raw carrots, and worst would be sour gummy bears.
Okay.
Yeah.
What's one dental habit that everyone should start today?
Rinsing your mouth after everything you eat.
And just with water?
With water. Just anything you put in your mouth, whether it's food or drink, if you take a sip of water after that and just kind of rinse, you should choose to drink it or spit it out. I think that would be the best.
Okay. How do you see dentistry evolving in the next 10 to 20 years?
I see it being more kind of transparent, more knowledge, like giving the patient more knowledge and being kind of, it's less, more transparent. Meaning, like with the imaging, there's even like some dental clinics that there's like a camera hooked up to the chair. You could see what's going on while you're for work.
Mm.
So there is that. There was a lot of in the past of a curtain where you don't know what's going on. I just go there, I lay back, they give me dark glasses, and they tap on my shoulder when it's done, you know?
Yeah.
But now with like the, again, imaging, with like explanation, all of that, there's a little bit more, you're empowering the patient to look out. So it's the patient looking out for their health, and we're just the instruments that are helping them.
Mm.
Yeah.
Are there any new advancements in dental technology that excite you?
So, so AI got into dentistry. It's into our like reading images, radiographs. So that's exciting because it can pick up some stuff that might skip you. It still has its bugs because it hasn't gone in fully. So that's exciting, and the a lot of printing some restorations such as crowns or printing is exciting because you could have the lab portion of the clinic in-house as well.
Oh, nice.
Yeah.
I guess that speeds the process up as well,
Speeds
right?
the process, limits the visits to the clinic, and you end up becoming like you're offering a better service because you're able to get the work done, better flow.
Okay. And should we rinse and spit after we are done brushing?
So if you're done with your brushing, you could just spit whatever is like the foamy part from the toothpaste and just do not rinse that, because if your toothpaste has some good additives that you'd want to stay, most of it comes from leaving it linger around.
Okay.
Yeah.
And I have a bonus question. Should
Extra marks for the
extra
one?
marks?
Yeah, okay.
Should people come to Broadway Smiles?
I mean, if you're out there to you're trying to care for your teeth, you're trying to be preventive about your teeth, then that's where we could help you out the most.
Okay. Now, before we wrap up, is there anything else that you would like to share?
Thank you for inviting me on your podcast. Thank you for being very nice to talk to, and yeah.
Okay. And where's the best place for people to connect with you or learn more about your clinic?
So on IG at Broadway Smiles, and at our website, broadwaysmiles.ca.
Okay. And for anyone in Vancouver looking for top quality dental care, you can find Dr. Mahmud at Broadway Smiles. And to everyone listening, if you enjoyed this episode, don't forget to subscribe, leave a comment, and share it with anyone who you might find it helpful. Stay tuned for more inspiring conversations like this one. Until next time, take care of your smile, and we'll see you soon. Thank you very much.
Thank you, Haidar.